Renin-angiotensin system. Kidney. When blood pressure drops, the kidney releases renin. Liver. Renin converts angiotensinogen from the liver into angiotensin 1. Lungs. Angiotensin 1 is converted into angiotensin 2 with the help of an enzyme, that is, angiotensin converting enzyme. Then angiotensin 2 binds with angiotensin receptor and shows various effects. Renin system blockers. They are angiotensin converting enzyme inhibitors, angiotensin 2 type 1 receptor blockers, and direct renin inhibitors. It is important to take into account the differences in the effect of renin system blockers when testing for identifiable hypertension. It is not recommended to block the renin system with 2 or 3 drugs, as it may lead to hyperkalemia and lower glomerular filtration rate. Angiotensin converting enzyme ACE inhibitors. Angiotensin 2 causes a direct vasoconstriction of precapillary arterioles and postcapillary venules, inhibits the reuptake of norepinephrine, stimulates the release of catecholamines from the adrenal medulla, reduces urinary excretion of sodium and water, stimulates synthesis and release of aldosterone, and stimulates hypertrophy of both vascular smooth muscle cells and cardiac myocytes. Common ACE inhibitors are captopril, enalapril, fasinopril, lisinopril, perindopril, ramipril, quinapril, and trandolapril. Pril are used as suffix in ACE inhibitors. Mechanism of ACE inhibitors. They interfere with the renin-angiotensin-aldosterone system, but their effect is not directly related to renin levels in the blood. As the name implies, ACE inhibitors block angiotensin converting enzyme that converts angiotensin 1 to angiotensin 2. Decreased production of angiotensin 2 enhances natriuresis, lower blood pressure, and prevents remodeling of smooth muscle and cardiac myocytes. Lowered arterial and venous pressure reduces preload and afterload. Also, the hypothesis is that ACE inhibitors interfere with the degradation of bradykinin, a peptide that causes vasodilation. Angiotensin converting enzyme regulates the balance between the vasodilatory and natriuretic properties of bradykinin and the vasoconstrictive and salt retentive properties of angiotensin 2. ACE inhibitors alter this balance by decreasing the formation of angiotensin 2 and the degradation of bradykinin. ACE inhibitors also alter the formation and degradation of several other vasoactive substances, such as substance P. The ACE inhibitors were the first blockers of the renin system to be widely used as antihypertensive drugs, often the combination with thiazide type diuretics. This combination is highly effective in achieving a sustained reduction in blood pressure and usually well tolerated. The ACE inhibitors also act kinase inhibitors, which may cause certain adverse effects such as a dry cough, that is 5 to 10%, and a rare occurrence of urticarial angioedema reactions, that is swelling of the lips or tongue, that can be fatal. When used in patients with renal disease and proteinuria, especially diabetic neuropathy, ACE inhibitors can reduce urinary protein excretion and may slow down the progression of renal impairment. ACE inhibitors, like all blockers of the renin system, may reduce aldosterone secretion when the renin-angiotensin-aldosterone system is normal, but not when primary aldosteronism is present. Angiotensin 2 receptor antagonist. Angiotensin 2 type 1 receptor blockers prevents the binding of angiotensin 2 to the type 1 receptor. This receptor is responsible for causing constriction of the blood vessels by the vascular smooth muscle and also for stimulating the production of aldosterone. by the adrenal gland. The effects of ARB are similar to those of ACE inhibitors, but they do not affect the production of kinin. A small fraction of hypertensive will have full control of hypertension when taking ARB, but these drugs are most effective in combination with a thiazide type diuretics or a CCB, calcium channel blocker. The most common angiotensin receptor blockers are losartan, candesartan, valsartan, telmisartan, irbesartan, and olmesartan. Sartan is used as suffix in angiotensin receptor blockers. Direct renin inhibitors. Eliskiren directly inhibits the action of renin, which makes it an effective drug for treating high blood pressure. When used alone, it produces a similar effect of blood pressure as an ARB. However, its effectiveness can be enhanced when used in combination with thiazide diuretics or calcium channel blocker. Unlike ACE inhibitor, eliskiren decreases the assay of plasma renin activity and serum aldosterone,